Hi, welcome to the Ambulatory Stroke Neurology Rotation at Sunnybrook. The purpose of this video is to orient you to our electronic medical record system called Accuro. We hope this video will be useful not only for the next few weeks, but also for your future practice in medicine.
So there's a red icon on your computer. You're going to double click on that and you'll be given a username and password. Here I'm putting in my username and my password and logging in. So when you log in, you will see today's day list, and the patients are usually coloured. This one is coloured in pink, and we only have one patient on the day list. And to note that you're in the electronic medical record section because this particular area is highlighted. You will actually have really much little to do with the other areas, so just make sure this area is highlighted and you'll stay in there. At the top bar, you'll see there's the day sheet, encounter notes, and virtual chart. You will be toggling between these first three icons. When you're ready to start reviewing the patient, you can click on it to highlight the patient. So I've highlighted Tester Chester right now, and then I'm going to click on the virtual chart icon at the top. And I can see there the referral and any prior investigations that have been done before the patient's clinic appointment. So at this point, I'm going to double click on the referral, which is opened up here, and I'm going to scroll through the referral and read it. So here there is a referral about a patient who's young with a history of transient right numbness in the context of a headache, and they're questioning TIA. You can either scroll through pages by clicking the arrow here, or just by scrolling with your mouse. Here there's just one page to look through. So I'm going to close that now. I'm now going into encounter notes, which is where you will be spending the majority of your time in clinic. So towards the bottom of the screen, you'll see this section called Physical History Optomed, in which the patient's vitals will be inputted by the nurse before you see the patient: blood pressure, heart rate, height, and weight. At the top right-hand corner of the screen, you'll see the clinic that you're in. The TIA clinic is a rapid TIA clinic on A2. But if you're on M6 in the Regional Stroke Prevention Clinic, then you can switch by clicking on the area and switching to the Stroke Prevention Clinic. This allows any referrals, paperwork, requisitions, or letters that are faxed to be faxed with the correct letterhead and therefore phone number and fax number. So when you're ascertaining the history from the patient, in this clinic we prefer that you've ascertain the past medical history, social history, prior to the history of presenting illness, so that the sidebar, which includes these domains, is filled out. And the reason for this is that it's a quick snapshot of the patient's past medical history, but also when you open up your new patient letter, it will automatically populate all these domains. So you explain to the patient that you're going to take all the past medical history first, and then you'll concentrate on the history of presenting illness at the end. Most of the physicians in the clinic do not populate the top bar, which is history of problems. So you can liaise with each physician individually and ask them if they want you to fill out that section. Otherwise, you're going to start off with the vascular risk factors here. In this area, I usually input any of the traditional vascular risk factors as well as any diagnoses that might be pertinent to a stroke patient. For example, a history of coronary artery disease, history of valvular heart disease, history of peripheral vascular disease, and even smoking. Any of the less relevant history, such as cholecystectomy, total hip replacement, etc., can be populated in the surgical medical history that I'll come to in a moment. So when you're inputting into the vascular risk factors, you click on the green plus sign, which will open up another window. You're going to type in to the box the vascular risk factor that you want. For example, if the patient has a history of hypertension, you start typing in hypertension, and then you'll see a number of options appear. You can click on hypertension and add in the notes section anything relevant to the history of hypertension. So for example, you can state that it's long-standing and home BP's average at 130/80. Okay, and then you save and close. It's important that for any domain that you limit the writing only to the notes section, because that is reliably programmed to automatically populate your letter as opposed to the other sections which are not. So then you save and close and you'll see it appear under the vascular risk factors. If we want to add in hypercholesterolemia, again we tap on the green plus sign, we start typing in hypercholesterolemia, we see that it pops up as an option. I can highlight it and write in the note box that the patient's been on a statin for 5 years, and then save and close. If the patient has no history of hypertension, hyperlipidemia, diabetes, TIA or stroke, coronary artery disease, so maybe a stroke mimic such as a migraine variant, and the patient has no vascular risk factors, then you can actually start typing in no, and you'll see an option for no history of these common risk factors, and you can add that in. If you want to show that the patient has not got a history of diabetes, you've asked for it, you can actually start typing in non and use the option of non-diabetic. If your patient has a history of coronary artery disease, for example, if you start typing in that vascular problem, it'll come up as an option, and you can fill out the details in the notes section and save and close. For smoking, if you start typing in smoke, it will come up with 3 options: current smoker, former smoker, and lifetime non-smoker, and you can choose the option that's pertinent to your patient and save and close. Moving on to the family history. In family history, again, when adding in details, you press on the green plus sign. And you can do this in one of 2 ways. You can either do it via the disease process itself, in which case you can type in stroke and in the notes section put in nil, or mother at age 75 died, and save and close. Or you can do it by the relation, so you can type in mother, highlight it, and then type in that she had a stroke at age 75 and died, and save and close. If the patient's adopted, that comes up as an automatic option, which you can highlight and save and close. And if his family history is unknown, for example, if their family was killed in the Holocaust or anything like that, there is an unknown option as well. For patients who have relations who have died from a sudden unexplained death, so they're surmising that it might have been a heart attack or a stroke, there is also an option for sudden unexplained death. So you can highlight that and close. The only thing I will elaborate on again is when you're actually choosing an option, again, that you can see that there's all these other areas that are blank. Don't feel tempted to fill these out. Only limit your information to the notes section, which will automatically populate your letter. The next area is lifestyle. For lifestyle, in this section you can put in the patient's alcohol intake, caffeine if it's relevant, for example if you're dealing with a TIA mimic such as migraine. Patient's usual diet, so for example, is the diet predominantly home cooked, is it high in fruits and vegetables and fish, and any restrictions in diet. Also here you can elaborate on patient's exercise, so what they do for how long and how many times a week. For example, walks 30 minutes 5 times per week and save and close. And the only other thing that you might want to elaborate on in lifestyle is question the patient about illicit drug use, particularly if they're young and they've had a cryptogenic stroke. Again, all your notes should go into the notes section alone. For moving on to surgical medical history, here we're going to put all the seemingly less relevant history that doesn't have any vascular implications per se. So for example, common surgeries are already present. So if you start typing in appendicectomy, you can highlight it and write the year, 1998, save and close. Similarly, things like cholecystectomy, you can and also inguinal hernia repair, you can start typing in and see if it's already being populated and save and close. If you're dealing with a less common surgery, rather than inputting a whole lot of new data into the database, you can actually just type in surgery, highlight it, and click the and then write in the notes section exactly what kind of surgery it was. So left fifth toe amputation 1998, and then you can save and close, so you can elaborate on what type of surgery that way. Similarly, for cancer, there's many common cancers like breast cancers that you can search for by starting to type in breast, or for example prostate. So you can find prostate cancer as an option. But if the patient has some unusual cancer that's not already populated, if you search the word cancer, highlight it, then you can elaborate on the rare form of cancer and save and close. Finally, fractures. If you want to elaborate on the location of the fracture, you can search for fracture, highlight it, and then in the notes section again, elaborate on where the fracture was and how it was treated and save and close. What to do if there is a medical diagnosis that you want to input that you search for that you can't find in the drop-down menu. So for example, if your patient has mesothelioma, we start typing in mesothelioma here, and no options appear in the drop-down menu. In that case, you go to the blue pencil sign here, click on it, then click on the green plus sign, type in the word mesothelioma with a capital, make sure you've got the spelling right, and then OK, and then close. Now, when you search for mesothelioma again, it will appear in the drop-down menu. You can highlight it, write in the notes section the details, and then save and close. For each of the headings, if you do need to add a new diagnosis, it's done in a similar way by pressing on the blue pencil sign. So now you scroll down to social history. Again, click on the green sign, and here it's free form. So you write paragraphs. So for example, born in England, migrated to Canada in 1998, completed grade 12 education, retired plumber, lives with his wife, has 2 children, drives, independent with mobility and activities of daily living, and you would write all this in and OK it, which will save and close. Of note, some physicians already have this inputted into their template, and so you would not necessarily need to fill out the sidebar for every physician, so check with each individual physician first. Now that you've completed the past medical history in the sidebar, you're going to open a new consult note. So you go to this drop-down menu at this arrow here, click on it, and on the left-hand side you'll see a bunch of options. For example, for my clinic, you'll see JH new consult letter, and each physician will have a similar template. So MB for Dr. Mark Bullos, or Amy for Dr. Amy Yu. So if we double click on JH new consult letter, it'll come up with a letter that looks like this. Everything that you've already inputted into the past medical history is automatically inputted into your letter. At the top, you can see that there's a template which you can modify. So for example, I had the pleasure of reviewing, it says Mrs. Tester Chester, and then you can click on in the Regional Stroke Prevention Clinic on May 10, 2018, either unaccompanied, or you can highlight in the presence of her husband. You'll see that when we automatically open up the letter, even though Tester Chester is actually female and has a designation of Mrs., each letter for any female will automatically populate with his, he, and there's a way to change this by scrolling down to this icon here where you can see male switch to female. So you can change the male pronouns to female pronouns automatically throughout the entire letter by clicking on that icon. So to carry on, she is a 29-year-old, and we've clicked right-handed female who, and the options here work best for the rapid TIA clinic on A2. So one option is who was referred by the emergency department for further investigation and management of a possible transient ischemic attack. Undoing that, the other option is who presents for review following an admission to Sunnybrook Health Sciences Centre with, and then if you just type in what she was admitted with, for example, a left MCA territory ischemic stroke, then you can put in the specific data. In the stroke prevention clinic, these options don't always work, so don't try and make it fit. If it doesn't work, then you can just, after who, write in your own history. So who presents for further investigation and management of a transient episode of right numbness. Okay, now you're going to fill in your history of presenting illness section. So you can see the heading here, and under here you're going to write the relevant history of presenting illness in full sentences, full paragraphs, not in point form. So let's pretend we're adding something here. And then after you've completed your history, you're going to go on to the examination. Just a note before we go on to the examination that for the medications, you do need to highlight the frequencies, otherwise they will not appear on your final generated letter. Scrolling further down, you'll see that the cardiovascular examination and neurological examination is automatically inputted to a normal default setting. It will automatically input the blood pressure and the heart rate that's been recorded by the nurse. But if the patient has an irregular heart rhythm, you need to modify this by highlighting irregular and unhighlighting the regular. And if there are any cardiovascular findings such as cardiac murmurs or bruits, you need to modify this paragraph accordingly. Similarly, for the stroke neurology physical examination, there is this normal neurological paragraph that's been inputted, but if there are abnormalities, you need to modify this paragraph. Also, depending on the template, it might be incomplete. For example, this one does not contain proprioceptional vibration, and you can add that in accordingly if there are concerns about peripheral neuropathy, for example. It's important to note that this is a neurology rotation. After all, you need to come with the appropriate tools such as stethoscope, pins, tendon hammer, because you are expected to do a full neurological examination on each patient. Below the neurological examination section, you will see that there is an area where you can record a patient's cognitive examination. Each patient gets a quick cognitive screen, which is found within the doc form that you'll see scanned in the virtual chart after the nurse has had a chance to see the patient. It's a score out of 10. Basically, it consists of delayed recall, clock drawing, and abstraction. And you can input the score out of 10 here. If the score was good, such as 9 out of 10, and you're not going to go on and proceed to a Montreal cognitive assessment, then you can delete this area. Finally, once you've completed that, you're going to input the investigations. So here there are a few investigations already inputted. For example, if the patient's had a non-contrast CT, you're going to insert the date, May 5, 2018. And then you're going to go into SunnyCare, copy and paste the entire report underneath. Same for other radiological results. The nurse, in the nurse's note, will have already recorded the most recent fasting blood work, routine bloods, and HbA1c, which you can copy and paste from her note into your letter. And at the bottom, you're going to see the opinion section. Mrs. Chester is a 29-year-old female, and then we expect you to give a short summary of the history of presenting illness, and some results that may be pertinent, for example, MRI or carotid ultrasound results that have already been done, as well as a summary of the neurological examination. Your opinion section should be detailed in terms of what the differential diagnosis is, reasons for and why not. Certain diagnoses may be excluded at this point, and your reasoning behind the investigations that you're going to order. If there are certain instructions that you're going to give the patient, for example, instructions not to drive for a period of 1 month or not to travel for a period of 3 months, this information should also be inputted here. Below that is the plan. The first heading is risk factor modification. Again, there is a template that you can choose to follow. So for example, in non-diabetic patients, you can click on a target of less than 140/90, or for diabetic patients under 130/80. If the patient's at target, you can press on target and then suggest no changes. If this template doesn't work for you, you can always delete a certain part and write in the information that you want to convey. Similarly, for cholesterol, the target cholesterol is automatically inputted as less than 4 and an LDL of less than 2. If the patient has had a history of stroke or coronary artery disease and you want to suggest an LDL cutoff of less than 1.8, then you need to manually change this. So then you can specify that they're currently on target, and then you're not going to make any changes and continue current statin medication. Once again, if this template doesn't work for you, you can delete and write in your own information. HbA1c less than 7% at target. thus continue current medications. And then for medication area, patient should continue on aspirin. Just remember that not every patient who's been referred to the TIA stroke clinic actually has a problem of TIA and stroke, and often we're seeing mimics such as migraine aura. If the patient is found to have a mimic like migraine with aura and there is no TIA stroke related issue, then you don't want to be recommending LDL targets of under 2, and you may wish to delete this section altogether if it's not relevant. Then the following tests, investigations will be ordered. So if you're going to go on to further investigations, you can highlight the investigations that you wish to perform: CT angiogram, MRI brain scan, transthoracic echo, and 48-hour Holter monitor, which would be a typical workup. And then no referrals at this time. And then the patient, in terms of follow-up plans, will be seen in follow-up in 3 months, or in 6 months, or in a year. If your physician wants to see the patient in 2 weeks, or 2 months, or something that doesn't fit into this template, I will now show you how to automatically change that. Before I do, don't forget at the bottom to sign as you. So under Sincerely, Dr. Joe Smith, PGY4, I am resident on behalf of, and then a colon. You don't need to specify the physician's name, because when the letter is generated, it will automatically populate with that information. So once you've completed all your sections and your highlights, there is a way to get rid of all the highlights. And the way to do that is at the top right hand corner, the very last button, if you press on it, will simply save all the information that's been highlighted and ignore the rest of the information that has not been highlighted. I encourage you to scroll through once to make sure that the formatting and the information is as you intended. And then you have essentially finished your consult letter. As you work on the consult letter, it's a good idea to save as you go. So as you can see at the bottom, there's this save option, which keeps the letter open and saves. If you want to close the letter and save the information at the same time, then if you press OK, the letter saves and closes, and then you will see it appear here. And if you double click on it, you can open up the letter again. Once you've finished the letter, some physicians in the clinic actually use a pink sheet to communicate with the secretary. So again, I went to the drop-down menu at this arrow, and the very top option under standard forms here is the A2, A4 pink sheet. So if we double click on that, it will open up this page. And this is the way we communicate with the secretary. So tests booked through Accuro, like Holter, Echo, MRI, can all be highlighted. Tests booked outside Accuro through Sunnycare is in this section here. And one of the options is CTA head and neck. So for example, if you're going to choose any of the investigations in this section, you need to specify what the secretary is going to write on the requisition, because she's going to order these tests on your behalf. So for example, we have a 29-year-old patient, female, with transient right numbness on May 5, 2018, and specify the time period in which you want it booked. Please book within 1 to 2 weeks, urgent. Okay. As we scroll down, you can highlight any referrals that are going to be made. So for example, if you're going to refer the patient to cardiology, neurosurgery, cognitive neurology, you can highlight that. And at the bottom, we're going to follow the patient in 3 months. Finally, if you're going to request a release of information, so records from an outside institution, you can also click under special instructions and highlight that you want to ascertain medical records, and the secretary will help you do that. So at the end you will save and close, and the pink sheet will appear under your new consult letter. If we want to book a test through Accuro, we go to the drop-down menu again. We scroll down. From the top, if we keep scrolling down, we'll get to a section that's entitled Requisition Forms. And all the requisition forms underneath that can be found in alphabetical order. I will note that most staff do not want you to fax the referral forms through Accuro, which is an option, but simply to save and close, but check that with the individual physician. If we go to MRI, then you will write the type of MRI that you want to order, the time frame, within 7 days please, and then you'll write the patient's clinical history here, making a note to not just simply write query TIA or query stroke, but to outline the symptoms and the site of the symptoms, and also the date of onset. Then you can complete the tick boxes as you would normally when you're filling out the MRI requisition. I won't go on here, you can see how it's done. And then you can save and close by clicking the OK button. Of note, when you click the close button, the form is not saved, it's simply closed. So if you want to save and close, you must always click OK. So you will see this here. There are other options. So for example, for the Holter form, almost all patients get a 48-hour Holter. Mark it as an outpatient. It's already ticked with the information of stroke and to rule out atrial fibrillation, and then you can OK, which saves and closes. For echocardiograph here, I'm clicking on it. Every patient gets M mode and Doppler. Patients under the age of 60 also get saline contrast to assess for PFO. You can type in the clinical information here, click root and source of embolus, which is standard, and anything else that you might be interested in, and press OK to save and close. And finally, if you want to complete a referral letter, again, you go to the arrow, which is the drop-down menu. On the left-hand side, you will see an option called Referral Letter New. You double-click on it, and you will see this template come up. Could you please see Mrs. Chester, a 29-year-old female, for the management of migraine with aura. And then it says relevant findings and investigations are attached. Please do not hesitate to contact me. Thank you very much. And you will notice that there's no option here for date, patient demographics, or the person that you're sending it to, but that's because when your staff physician generates the letter later, you will see that depending on who they choose, this information will automatically be populated into the letter. So it's not something that you need to worry about. You just need to put in the reason for the referral. And then you can save and close, and the referral letter will appear next to the new consult letter. And that really completes your basic Accuro training. Please don't hesitate to ask your staff any questions if you encounter any problems that we haven't covered in this video during your clinic experience. And have fun and good luck.